DMSc stands for Doctorate of Medical Science. It is a program that we have within the department that is for PAs who have a master's level degree to further their education.
Healthcare is incredibly complex and it changes very rapidly. And during our training as PAs, we learn medicine and we learn about the healthcare system, but we don't necessarily learn enough to have a deep understanding of how all of the pieces of this system work together. We've designed a curriculum that takes a deep dive into some of these things that are very difficult to wrap your head around when you're busy learning how to take care of patients. As PAs, if we want to be change agents and be at the table in conversations about how we can improve the system, we really need to have a more in-depth understanding of how the system functions and how each piece works together. Things like financing healthcare delivery, development and implementation of policy related to healthcare access, advanced technology, specifically in our program, health informatics. And so we have designed this program to build on what we learn in PA school so that we can better take care of our patients and so that we can help improve what we know is a very dysfunctional system.
One of my concerns about going to an asynchronous online program is that the content wouldn't be engaging, and it's incredible. The faculty are experts in their fields. I worked 2 jobs while I was in the program, so I had my teaching job and my clinical job, and I was a little bit worried about being able to get through it, but it's really, it's perfect. It's all meaningful. There's not busy work. It's all applicable to both my faculty position and my clinical position, and it's really thoughtfully designed.
Our program is very much focused on developing solutions to challenges. And so we have brought in content experts from outside the field of medicine to help us better understand the finance piece, the legislative piece, the health equity piece, the technology piece. And I think this makes our program unique.
We are really focused on helping to improve access to healthcare to underrepresented populations and people who have less access to care. That mission is really carried throughout the program. It's not just talk, it's something that the program is really dedicated to.
The program was amazing in terms of kind of changing my perspective on my role as a PA beyond just patient care and specifically advocacy and understanding kind of health system delivery in a way that I didn't grasp before, which sounds silly because as being a PA for 20 years, I thought, I totally understand the healthcare system. And the doctoral degree just gives you so much information in a way that you didn't have it before.
We work in this system that's very complex, and the longer you're involved in the system, the more dysfunction you identify. And so our goal is to bring all of us up as a profession so that we could be better engaged in making positive change in this system.